She's a doctor.
Hi, I'm Dr. Dovec, and she's a dietitian.
Hey, I'm Hannah Schuyler, and together we are the
Doctor
Doctor Dietitian Collab.
Help! I just had bariatric surgery. Is this
Ah,
normal?
oh my
Is
gosh.
this normal? Oh, all the feelings, whether it's gas pains, bloating, or even the emotional ups and downs, everything that you're experiencing in those early post-op hours to days, we're going to break down and give you some really great tips to help to get through that period.
Yes, this is a question that we get every single day
Yes.
of like, is what I'm experiencing normal? And I think the hard thing is that it's kind of like when I was pregnant and you'd go in and you'd be like, I have this cramp in my leg, or I have this weird pain, or I have, whatever. And the doctor's like, yeah, that's normal. And you're like, but like, it doesn't feel like it should be normal, but they're so used to seeing it all the time. And it's very similar with this of like, yeah, it might suck, but it's probably normal.
Oh, I know. And then you
And
just
that's such a frustrating
it
answer
is a
too.
frustrating answer. And it's like, well, I want it to go away. And we're going
Yeah.
to give you ways to make it go away. And it's funny you bring up that example because I was going to bring up the example of the first night home from the hospital with a newborn. I
Yeah.
just remember ripping through. I had this book I read. It was called Baby Wise, and it was all about getting your kid to sleep and the schedule and all the things and the first hours. It outlined it all. And I was like ripping through that, like that was like some sort of like user's manual on
Yeah.
this kid. And I think people will rip through our bariatric surgery success guide that we have, or like, I don't remember any of this. Like nobody warned me about this because it's not happening to you,
Yeah.
and you want to know like, is this okay? And like, I want it to be done.
Yeah, and also we can't predict what your response is going to be
Mm.
because we do have kind of two ends of an extreme on some of these things. Even we'll take drinking water for example. Some people like they wake up and they're like, "Yep, I'm drinking water. It's no problem." Blah blah blah. And other people are like, "I cannot get in one solitary sip." And
Yes.
like that's both normal. Like, I don't, I'm so sorry. I wish I could have told you beforehand what to expect, but it could have gone either way, or more likely you'll be somewhere in the middle.
Exactly. So I think the biggest thing is the physical feelings of
Hmm.
this. And I just want to start off and talk just briefly about what to expect. You come in the morning of surgery, you'll change into the hospital gown, you get the little bouffant for your hair, you get these squeezing things on your legs, which help to prevent blood clots. You will get your IV. Sometimes people, their hand, their arm will hurt worse than the actual abdominal discomfort. They'll give you lots of fluids, you'll get an anti-nausea med, anti-pain med, and then you have your surgery. Now, the next thing you know, it's over, you're awake, and you're in the recovery room. And you have this very legitimate gas pressure, the
Hmm.
gas pains. And I want to spend a lot of time talking about what that feels like and how our patients really do recover faster and are able to do these procedures as a same day discharge, or basically just recover in their own home environments or in hotels or just
Hmm.
all of that kind of stuff.
Well, starting with the gas pain, can you talk a little bit about the process of like the gas during surgery?
Yes, so we do these with laparoscopic techniques. That means in order to do it with little tiny incisions, where we have to blow your abdomen up with CO2,
Hmm.
because that's going to create a working space between right now your abdominal walls right up against your omentum, which is your fat, the intestines, and so you need to separate those two. So you make a small little incision, you put in what we call a trocar. The camera will go in there, and then you connect a port to the port. You connect just basically gas tubing, and then you just blow it up. And we blow that up to 15 millimeters of mercury of pressure. So you blow it up to 15. Now, sometimes if I really need more space, like for example, if you've had an abdominoplasty or a tummy tuck,
Hmm.
that means that they pulled that really tight. So your abdominal wall doesn't have much give to
Okay.
go and separate off. So I will sometimes increase that intra-abdominal pressure to 20 to give me a little bit more space. I try to keep it as low as possible because that will, the peritoneum or the lining of your abdominal wall, that has to get stretched more, and
Hmm.
that can cause the discomfort.
I
Is
gotcha.
that is in that how long you're under anesthesia, how much pressure that I'm using. So I try to minimize both of those two things. So the best people are those who've had a baby, Those who've had twins, oh my God, triplets, I can do like round off back handsprings in your abdomen. It's like an arena of space. There's so much space with a very little bit of pressure. And those patients typically recover really well.
Yeah.
Actually, the larger BMIs, uh, if your BMI is over, let's say 70, 80, let's say that you weigh 4, 5, 600 pounds, actually, those patients have almost no pain afterwards. They
Hmm.
don't really have gas pain.
Yeah.
But if your BMI is, 60 or less, you're going to have this pressure.
Yeah.
The kind of the lower it is, the more you're going to have of that because your peritoneum is really just stretching in it, and that causes discomfort.
Yeah. That makes sense.
And not only that, you'll also have some trapped gas, even though we do take great lengths to try to get it all out of your abdomen at the end of the procedure. We take a suctioning device, we try to suction it out. We actually give some pressure from anesthesia to try to like push it out that way.
Hmm.
But even with those measures, sometimes you'll have a little bit of trap gas. And usually all the working area is in that left upper quadrant,
Hmm.
the base of your chest bone. So that area is kind of where your heart is. And
Yeah.
so people will freak out that this pressure they're experiencing, and it's a lot of pressure. You feel like, oh my gosh, like if I could burp or fart or like pop the Tupperware container to
Oh,
like get some relief, but I can't get it out. And I'm like beating on my chest and having a heart attack. Like,
yeah.
what is happening? And that sensation is absolutely expected.
Yep. Yeah. It's kind of funny because obviously going through this, I have learned a lot through the time of being in bariatrics. And sometimes I'll answer the phone and people are like, I'm having this pain. And I'm like, and it's in your left rib right under your breast. And they're like, yes. Yep. That's again totally normal. I'm sorry that it's happened and we can kind of talk through some things that to help it, but it's like I tell people I'm like, that's kind of where the work is done
Yes.
too. So like it could also be sore in there. It's just maybe a little bit of inflammation going on because
Yes.
you did have surgery despite you only have these four little incisions. Like
Yes.
you still had surgery inside. And so, but I'm like, but also there's a chance that you have like a gas bubble right there. And it's gotta work, it's gotta move out.
Exactly. And there's actually two places. So, yes, we talk a lot about blowing you up with the CO2,
Hmm.
but there's a second place that I am. So, your GI tract. So, when you swallow air, it will become a fart.
Hmm.
And so that's going to happen even if you're not really eating much or drinking much. You're still going to have bowel movements, maybe more liquid, but you're also going to be passing gas every single day. And that might take a little bit for that to wake up. Now, when I do a gastric bypass and a sleeve, but especially with the gastric bypass, I will do a leak test to see if your connection, anastomosis between the thumb-sized stomach pouch and your small intestine, is that a 360-degree airtight seal? So I clamp the intestine, but we have anesthesia blow you up with 25 millimeters of mercury pressure. And that is, so we have them kind of take it off suction and suction a little bit as they're removing that tube. So we're blowing you in your GI tract and we're blowing you up in the abdominal cavity. And so it's like this double whammy that all that air that's put in your GI tract is also going to essentially be going through your small intestine, your colon, and you're going to have to really just fart that out.
Yeah. And so that's the other place that we do here. And it's in a similar kind of spot is that left side, but it's actually like where your colon goes from like being transverse, so going across your belly
Yep.
to going down. There's almost like a corner there and it
Yes.
gets like caught. And especially like I think if you have stool back there, because it just
Yes.
gets stuck behind it, like think
Yes.
something like traffic. And so, and it's right at that corner. So people tell us like all the time, it's that left upper lower quadrant kind of midline and you're like right near your belly button almost but like on the
Yes.
left side.
Exactly, exactly. And so you need that to come out. You got to get aggressive. So both of these things, whatever type of gas and air and bloated that you have, the best key to success is moving.
Hmm.
You gotta move. You gotta move because it'll just sit there until you kind of get things
Yeah.
working its way out.
I keep going back to babies probably because it's like the most relevant thing in my life right now, but you think about like if you had a gassy baby and what would you do with them is you pedal their legs, you get their little bodies moving, you
Yes.
stretch their arms up. And I tell people this too, and they're like, I'm walking, I'm doing that, because that's
Mhm.
always the first thing we say is like walk, walk, walk. And that I always like to go back to this because sometimes people are like, 3 miles
I know.
after surgery. I'm like, no, I meant walk like laps around your couch.
Yeah.
Like, just
Here to the
go
wall.
here to the go to your walk to your kitchen and fill up your water and come back. Like that's what really we mean by walking. Or sometimes even standing in place and just like again kind of pedaling your legs or lifting your knees up, but also like getting your hands above your head because that's going to help to create that space in in your body, like the to allow that air to come out. Or again, like there's even yoga
Mm.
positions that are good for like trapped gas. You can look up like yoga probably for constipation or yoga for gas or something like that on YouTube, and you'll find something. And so like it might be difficult to get into those positions especially if you're having pain with your incision
Yeah.
sites or anything, but you might be able to modify or kind of use that idea of it, or use like a towel or something to help bring your feet up, like if you can't reach your toes, like you can use, some other implements. But like the happy baby pose, I mean, that is a great one.
Ah.
It's scary to do that one in a yoga class because you never know what's going to happen, even if you haven't had surgery. So,
Seriously, I want you guys rocking around. Get this
yeah.
gas out.
Hmm.
So I think, first thing is just like, gosh, the babies and things, but have a plan. So get organized. Your mindset matters. You really need to wake up on a mission. And I think whatever you're thinking when you undergo anesthesia, and kind of like, all right, I am going to walk. I know there's going to be pressure. I'm going to just like go for this. And if the nursing team, everybody's in alignment about feeling better and starting your recovery as soon as those eyes open after surgery and you're stable enough to kind of start moving around. It sounds trivial, like, okay, I got it. I'm like, but it matters and you
Hmm.
will do better if you're kind of feeling that way as well. So
Yeah.
have that right mindset. The first few hours and days, they're a little challenging, but fake it till you make it. And it will pass. This too shall pass, literally, and you're gonna feel better very, very, very
Yeah.
soon. I promise you. Now, next thing is get organized, get prepared. You really want to stock up on all of the essentials. And there's a lot of over the counter remedies that I think are pretty helpful. We recommend that our patients get Gas X, which is simethicone. And I know that it says take one every so many hours, but you really can't overdose on this. So take two, take three. Those first few days, you're going to want it. So just take a lot of Gas X. And then, like you already mentioned, the incisional soreness,
Hmm.
Tylenol extra strength. And that will help with that mild kind of discomfort. It feels like you did a million sit ups, it's muscle soreness. They're little incisions, but you're going to want to stay ahead of that Tylenol. So, like it says on the bottle, you can take up to two at a time, 1,000 milligrams, double up on it every, whatever it says, 6 to 8 hours when you're awake, and do that for the first 3 to 4 days just to help to, again, stay ahead of it.
Hmm.
It's really important.
Yeah. And then you'll also, I mean, from us, you'll get a prescription pain medication as well. And if you need that, take it. It does
Yes.
slow things down though. So like from that GI standpoint, any kind of narcotic does slow that down. So, if you don't really need it, I think the best thing is to not take it. What do you
Yes,
think?
I agree. If you don't really need it, don't take it. But I do think, and there's all this stuff. It's called enhanced recovery after bariatric surgery. And it's really fixating on minimizing narcotics because, like you said, it slows down that gas from passing through your GI tract and passing gas and having bowel movements. And that's really important. It also makes you drowsy. You cannot drive on narcotics. But I do think that we're always like, like be strong, don't take it. And people do come to us and say, like, with a badge of honor, like, I'd even take one of my pills. That's awesome. But don't look at it as a sign of weakness. That first night, especially,
Hmm.
you're going to be like so restless. And I always tell people the night before surgery, you're not sleeping great. You're anxious. Your mind is racing. It's just like, oh my gosh, this major life event is about to happen in the morning. Like, I have to be there at 5 a.m. Like, what happens if I miss my alarm? Like, it's horrible, very superficial, shallow sleep if you get any shut eye at all. And then the next night, now you're restless, you're sore. So 2 days in a row without sleeping, I talk a lot about kind of that emotional, weepy,
Mm-hmm.
just, oh gosh, you're not you when you're hungry, you're not you when you're tired.
Yeah.
It's like, oh, it's already like all these things. Why did I have to do this? The regrets. We're going to talk about the emotional side of it. It's a lot. It is no doubt a lot there as well. So try to sleep The key to success is once you get a few consecutive hours of sleep is when you will start to turn the corner.
Yeah.
If that happens the first night, by the day after surgery, you're starting to feel better that soon.
Yeah.
So, 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 so important.
Yes. So I think that, yeah, like you're saying, like if you need it that first night, just to help you sleep, that pain med can be beneficial. Because like you said, it also makes you drowsy. So it helps with cut the pain, but also like, it's gonna knock you
Exactly.
out a little bit.
And speaking of sleep, I'm like, all right, get yourself set up like we're talking about here. So, what I would do is I would take 3 Gas-X, 2 Tylenol, an oxycodone. I would maybe even consider having, a bunch of pillows to keep yourself more
Yeah.
upright. Like, so the position you're sleeping in. So, what positions do you tell patients about like sleeping to get comfortable and all of that sort of thing?
Usually I feel like early on they want to sit upright, so even in a recliner or
Yes.
something on their back. But some people are like, I cannot sleep if I'm not on my side or if I'm not this.
Hmm.
To me, because I've heard you say this too, like sleep however you're comfortable.
Yes.
And if that means on your side, that's fine. And maybe you're putting a pillow under your stomach to kind of support it, to keep
Hmm.
that. Again, it's like it's all like being pregnant in my mind because I haven't had surgery, so I can only relate this to things I've done. So in that case, like having that weight supported of having your stomach up, that
Yes.
was really helpful. Yeah, I do think that, but it's really where however you're comfortable. So I think to me that's the best thing, but I do think like upright or propped up because that can help also. I think like gas kind of if you end up burping and stuff.
I agree. People love their recliners. Some people have like these bougie beds that actually like go
Oh
up and
yeah.
down. A lot of patients have those.
Really?
Yes.
Oh.
I'll describe it. They're like, oh, I got a mattress my side. I'll put it up. I'm like, wow, that's
Yeah.
incredible. Otherwise, yeah, lots of pillows or like, listen, whatever is the most comfortable position is the best one. If you're rolling around, belly sleepers, I have a lot of belly sleepers out
Uh-huh.
there. I do not sleep on my belly. Do you?
Not regularly, no.
I mean,
Occasionally I will, but I'm a
maybe.
side sleeper.
I'm a
And once
side
I'm in my
sleeper.
position,
Yep.
I'm there. I might roll once and then I'm on the other side and that's it.
What side do you roll to?
I start on my left
Same.
and then
Right.
like if I like maybe if I wake up to go like to the bathroom or something, or if the baby wakes up or something, I'll get in bed the other direction just because sometimes in my back, like
Oh yeah.
I don't want my back to hurt.
Good call. I always start off on my
So I
left side
always
as
sleep on my
well.
left side. Yeah.
I take off my glasses, roll over to the left. Good night, babe. Yep, he
Yeah.
knows it's done. It's done. About
Away from the husband.
heck yeah. I'm like
I don't need your breath in my face. And you
no.
don't want my breath in your face.
Whenever
So,
I accidentally roll to my right and he's to his left and we're facing each other, I'm like, oh my God,
uh-uh.
no, this is awful. Okay, so we don't want anybody's partner's got breath in their face when they're trying to
Mhm.
recover. So we've established that. Things that people say they can try. It's like you're bloated. It's, my ladies, it's like kind of period cramps. So some people do heating pads.
Mhm.
Don't fall asleep with that on you though.
Yes, that can be
Um,
really dangerous.
it can be very, very dangerous. So make sure that you're awake, obviously. Also, some patients, I use a deep stitch when we're doing a sleeve. That's this in the incision to the right of your belly button. Or if you're having a revisional procedure, I'll oftentimes pull your muscle together in that same area. And so some people even put like a 4% over the counter lidocaine patch on that area.
Mm,
I don't know if that's necessary. These are really tiny incisions. But maybe it may help to numb it and
mhm.
make you feel a little bit better in that
Yeah.
regard.
Yeah. And then, yeah, the warmth I think helps with a lot of things. So, like, take a warm shower. Even sometimes I think drinking a warm beverage. And if
Mm-hmm.
you're struggling with drinking, sometimes like we always tell people try different temperatures. And I think a warm, like an herbal tea or like even a ginger tea. Sometimes this goes along with having like some nausea or you feel that kind of
Yes.
way. Like something soothing, like a ginger tea might help.
Good tip.
And that kind of to me like relaxes your
Hmm.
system a little bit, like that warmth going down, or the broth. Sometimes people still like that after surgery.
Yeah, and sometimes people get like really sick of the super sweet, the protein
Yeah.
shakes. They're just sick of the flavors, and then like even the artificial flavoring of like Propel or Gatorade
Mhm.
Zero. So I agree. And then as far as the shower goes, you can take one with us as long as you feel like you can stand. And,
Mhm.
obviously safety first, common sense first. But we do use a thin layer of waterproof skin glue over your incisions, so you can get them wet immediately after surgery.
Mhm.
And People will tell me they'll just like kind of stand in there for a long time
Yeah.
and just try to like just relax. Like you should feel relief. You did
Mhm.
this thing, some of the hopefully the anticipation and the anxiety and those the workup is now over.
Yep.
And so now it's like, all right, this begins. I'm prepared. I can do hard things. Like
Yeah.
it's a lot, but I think there's a lot of that sort of thing. So set yourself up for maximum comfort, have your medications
Mhm.
ready. Hydration, you did talk a little bit about that.
Mhm.
So that is something also so critically important. It's
Yeah.
like movement, hydration, and rest are your three equally important goals.
Yep. Yeah. And I think that going off of that, people think that I think they dismiss rest a little bit too much. Because
Yes.
again, we have people all the time that are like, I am up and I'm walking and I'm walking and it's like, okay, that's really great. And I respect that you're listening to us. I really appreciate that. But like, rest
Mm-hmm.
because you
Mm-hmm.
are healing again. Yeah, you have these four little incisions. So externally, you might be like, it doesn't look like that much happened, but you still just had surgery. And it could, I mean, if you've watched our videos of what surgery looks like, there's a lot that goes on. Like we explain these procedures to you and all of that. But once you're really in there, I think it's, there's a lot that goes on and your body needs that rest for sure.
I
And that
think
can be hard. I'm not telling you that it's always easy to rest, but
right.
do your best.
Such a great point that you make is that I think for so long it's like walk, 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 sip, 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 come on, go. I'm posting my Apple Watch. Look how many miles, my steps. I'm killing it to collapse
Yeah.
mentally, physically, emotionally because of all like whoa, 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 whoa.
Yeah.
I know some of you guys are type A. I love it. You're after my own heart here. I'm the same way, but I have realized that I think that the sleep part is something that I just didn't stress for too long.
Mhm.
And that is absolutely key. So my friends, you must sleep and don't set alarms and don't have anybody wake you up like, I go to walk every hour. Yeah, while you're awake.
Mhm.
Now, I will tell you there are some trends. Like we said, we can't predict what will happen to you. Everyone's different. Everybody also has different uh past medical histories and surgical histories, and you might have some adhesions or scar tissue in there that might increase your operative time. It might change, just the dynamic of your healing and that sort of thing. So, of course, we'll talk about that at your consultations. So that's really important. But you really want to make sure that you are just doing the same kind of pillars and all that kind of stuff. So set yourself up for success. And talking about hydration, I also want to talk a little bit about the diet progression, both leading up to surgery and
Mhm.
after surgery, and how this can also set a framework for really improving your recovery.
Yeah. So, we'll start, it's kind of like you said, we'll start at the beginning or before surgery. So, this is something that's different with different programs. So, if you're not a Body by Bariatrics
Yes.
patient, please listen to whatever your program is saying. Um, there's what I'll say on this is there's not a lot of great research about what the best like pre and post op diet progression is. That there's just not a lot of research there about it. So everyone's just kind of making their own decision based on their clinical practice and what they think works in all of this. So that's that. So you may hear, if you're one of our patients, you might hear something different too. And you're like, wait, do I need to do that? My cousin had surgery and they did this. And I hear this a lot. So listen to your practice, whatever they say, as far as the pre and post op diet progression. So what we recommend is that as soon as you want to start, but at least usually about 3 weeks, or if you're getting through the process sooner than that, faster than 3 weeks from your consult to surgery, which happens sometimes, that's fine too. But we want you to be as best as possible on that starch-free diet. And so that just means you're avoiding the bread, rice, pasta, potatoes, corn, peas, yuca, anything made from grains. Can you tell I've listed these things
Wow.
before?
I've never heard you do that.
Oh yeah, I do this like 8 times a day. So you just want to really cut those things out, the sugary beverages as well. So sodas, juices, any kind of like lemonades, fruit punch, whatever. Really try to get rid of all of that leading up to surgery. And that's going to help really from my perspective that helps with the post-op diet as a habit. So it's not even so much as like a physical preparation. It is, but to me it's that habit preparation and you're learning, you're picking up some new recipes or you're modifying what you're currently making and doing all sorts of stuff like that. So that's the couple of weeks leading up to surgery. Then the 2 days leading up to surgery, we want you on that sugar-free, clear liquid diet. And do you want to kind of explain what that does?
Yeah, it really helps to shrink your liver,
Mm-hmm.
and it really takes the swelling out of your liver. It makes it easier to be able to see your stomach because your liver is sitting on top of the organ of the stomach in the left upper side. And we use a liver retractor to get that out of the way. If it's really thick, heavy, and large, fatty, it can be very technically challenging. The harder it is on me, the harder it is on you because
Mm-hmm.
you're under anesthesia longer. That's
Yeah.
all plays into it, and it can hurt. And the second thing is it really helps. You might even lose some weight on those 2 days.
Yes.
um it's fun. Those 2 days are I think hard, especially the first day. I think once you
Yeah.
make it through, because it's almost like, oh, I have to do this for a whole nother day. But then once you're in the second day, you're like, all right, well, tomorrow's it. I'm finally done with this.
Yeah.
So it's challenging, but it really makes a difference if you follow those 2 days of just sugar-free clear liquids that you can see through.
Mm-hmm.
And like you said, you can do broth, but you can also do some kind of clear liquid protein water.
Uh-huh.
There's a lot of different examples. We have all this outlines, all the different things. And then, of course, the day of surgery, nothing to eat or drink. And you want to drink a lot in those 2 days.
Yeah.
You want to drink a minimum of 4 liters per day,
Yeah.
5, 6, 7, 8, 9, 10 liters, so that even your urine is see through, because you want to come in so hydrated that your IV placement is easy,
Mm-hmm.
that when we put you in a certain position in the operating room, you have enough kind of circulating blood volume, like your tank isn't on empty, so that, oh boy, we put you in that position and now you're tanking, your blood pressure is going low, and
Mm-hmm.
we have to re-level you, calibrate that. You want to have your body in as tip top shape as you can for
Yeah.
this. This is a big deal.
Yeah. So that's the 2 days. And you'll hear us say 2 days a lot. People are like, should I do this for 2 weeks?
No.
No.
It's
Don't do
okay.
3 days. Don't do 4 days. It's 2 days because you're getting very minimal calories. I mean, you are getting nothing really from this. You're getting some sodium and this is why we recommend like do some broth, do some
Yeah.
of these electrolyte type drinks. Don't just do plain water because
Ooh.
you're going to be, we don't want you like hyponatremic or anything like that. So mix it up, add some extra stuff in there. But just you want to be sloshing around when you come. You're going to be peeing
Mhm.
90 times. Don't worry about what you're going to do those days. You're going to be peeing. That's going to be your job. And stay busy. I think that's usually the other recommendation just to
Yes.
get through those is like stay busy. Just like I don't know, just power through it.
Power through it.
Yeah.
And I would still go to work. People say, should I
Hmm.
take those days off? I'm like,
No,
no.
be distracted.
Yeah, you don't want to watch TV and all the ads, and everywhere you look, you see food and
Yeah.
it's like your family, and try to like,
Yeah. Maybe avoid the break room.
oh, the break room always.
Yeah.
Yeah, those sorts of things. Like, yes, try to just mentally just get laser focused on it.
Yeah.
You really have to.
So when you wake up from surgery,
Yes.
you're immediately going to be allowed to transition, like quote unquote allowed, but to transition onto what we call the full liquid diet. And
Yes.
this is where sometimes people get tripped up. And I've seen people a week in a post-op and they're like, I've been on clears for the last week. And I'm like,
Oh
no,
my
like that's
gosh,
not
no.
it. So you immediately are on the full liquid. Now, what I will say is I bet there's a lot of people out there that just want to keep doing clears for that first day after surgery.
Yes.
And truthfully, that's fine. If that's what's comfortable, if you can drink that and you're okay with it, especially if you grab one of those, like if you can get in like protein water or something, no, just do your best to really drink. And there's a lot happening. So
Yeah.
don't stress too much about it. But definitely next day, you want to start to try to add in some of those other things. So the difference between the clear and the full is clear doesn't mean, first of all, it doesn't mean like white clear like water. It can have
Mm.
color to it, and it can be any color. So reds and purples are fine.
Hmm.
If you've ever done any other surgery prep, those sometimes are not allowed. Those are fine. But the definition is like that light can pass through it. And so now you're going to be on the full, and that's going to be where you start adding in. Really, the big thing is going to be the protein shakes on that first week. So this is the first week after surgery on that full liquid diet. And that's where most of like your protein is probably going to come from is protein shakes. But you can also do things like creamy based soups. You can do there's like drinkable yogurts out there, or you can thin down regular yogurts or kefir or anything like that. It's a pourable consistency is what you're looking
Mm.
for. So you don't want any bits and pieces. If it's like a like a cream of chicken soup, for instance, that you're having, you'd want to strain out those little pieces that are going to be in there, and that would be fine. So, and again, you're really just trying to get really, really well hydrated. A lot of people in these first 2 days, they're like, I can't meet my protein needs yet. And it's like, that's okay.
Yeah.
We truly don't really expect you to. I mean, and some people can because they can get in like 2 or 3 protein shakes a day and they're like, they're golden. Some people aren't, it's not that easy. So don't stress, do your best, try and get it in, but you're going to do the clears plus the fulls. So that's the other thing. You want both.
Yes.
You want both in that first week.
Definitely. So those are your first few days. It's hydration, 64 ounces minimum of fluids, sugar-free fluids, and you want to try to get your protein, which is 70 to 100 grams, 20 to 25 grams per serving. It's really hard. You're like,
Yeah.
I'm filling up on a sip and I'm done.
Yeah.
And that's why we want you to kind of separate things in the beginning as well.
Yeah.
You know, there are 3 trends that I see that I already told you one, and that is for higher BMIs that patients don't have as much pain.
Mm-hmm.
The second trend is in older patients I see. So I'm not going to put an age on it, but the older you are, the more likely you are to also not really have much pain at all, but you are tired.
Oh, yeah.
So their big thing is that they are taking naps. It's like, and it lasts a long time. So the younger you are, we do ages 15 to 80. My 15-year-olds will literally not turn a hair. They will be like right back to activity. They won't even sleep an extra 5 minutes. It's crazy. Older, my 80-year-olds, they're going to be taking naps, and it lasts upwards of, 4 to 6 weeks after.
Yeah.
It's just like this, like really just bone tired.
Yeah.
But it's like, man, I don't even feel like you did the surgery. It's really bizarre.
Yeah.
I feel that way as well. And then, okay, wait, what was my third? I had a third generality here. Yes, it is. You can actually, I really believe, get in shape so that this is an easier recovery. So the patients that are like, I've already kind of made changes. Like you said, they're kind of going to starch free beforehand. They're minimizing all the junk. They're keeping their net carbs low. They're following the diet, this plate method, majority protein. They're seeing some weight loss on the scale.
Mm-hmm.
They're starting to work out. They're starting to move around a little bit. And
Yeah.
we talked about this a lot. You don't need to work out in the early days before or even after surgery to be successful.
Yeah.
That come when it's safe and when you're mentally ready for that. I really feel that if you push that too early when it's not the right time, you're doing yourself a detriment.
Yeah.
People who are able to kind of work out beforehand and they've lost weight and they made some of these changes, they're also like waking up like doing jumping jacks.
Yeah.
So that's the 3 kind of generalities that I see.
Well, and that's something I talk to patients about a lot. When we look at why do we make some of these recommendations, especially with protein and exercise, and we're going off on a little tangent here, but that's okay. But it's about this like underlying muscle mass. So if you think about what our bodies are made of, we've got bones, we've got fat, we've got muscle, like we've got connective tissue, we got all sorts of stuff. But really what we're looking at when it comes to weight loss is we want to lose fat mass. And we need to protect that underlying muscle mass. And the way that we do that is we get in enough protein and we exercise. And that's how we keep our metabolism up, and that's how we, support our bodies and make sure we're not falling when we're old and all of that. But yeah, so I think that that's kind of one of those things that you can really start to develop even leading up to surgery. And then, exercise, even though it's acutely inflammatory, it's long-term anti-inflammatory. So I think you can really kind of get some of that inflammation and stuff down too in that pre-op.
Good. Yeah, good way of phrasing that. Yes, I completely agree. And we have a lot of movement tips, our mission movement
Yes.
we have, trying to keep you motivated and start small and make smart goals and really accomplish that as well will give you that long-term success, no doubt about it. Now, one of the biggest things that I think that not enough people really put in, maybe even the thought of, they don't think this will happen to them, is the emotional roller coaster.
Yeah.
And it's sort of like this early phase of, like I said, exhaustion.
Yeah.
But there's also this, we talked a little bit about regrets, but also this grief. I really think that, we talk about Laura Grabo. She runs our Project Reset, lots of things. I think that concept is one that you have to almost know that you're going through.
Yeah.
That's a lot to deal with.
Yeah, and you know, we've talked about our like our Facebook group before, and we tend to see a lot of you know, similar questions pop up, especially every couple weeks, every couple months, we'll get a similar thing, and you know, I'm like, oh, I've seen this before, whatever. And it's that I would say it's at 6 weeks post-op,
Mm,
and some people are like, I regret this, and all of the comments were like, I did too at that stage. Just keep going. Just
yeah.
like you in 2 weeks, in a month, in 6 weeks you're going to be like, "Oh my god, what was I thinking at that stage?" And I think that a lot of this, and I think people that struggle with that early post-op, with the pain, with the fatigue, sometimes that's still lingering with them, like
Yeah.
they're the ones that at that, would you agree on that time, like 4 to 6 weeks somewhere in there, that people are
Yes.
just like, "What did I do?"
Oh, yeah. And I think that it also has to do with the only bits of objective evidence of all this hard work. And like, I have never tried harder in my life on something. I'm tired. I'm beat up. I'm sore. I'm hungry. I'm pissed. All of these things, the only thing you got is a scale. So then we're also in right in conjunction with this, I regret this, is I'm not losing enough weight.
Mhm.
I only lost X amount of pounds. And it's like, I haven't lost a pound in the last 2 weeks.
Yep.
And we talk so much about you're going to lose an average and you might lose it in one day and then nothing the next 29 days, or you might lose it slowly over time. You're going to have stalls. You're going to have these moments where you think that, oh, just like I thought, it's
Mhm.
not working for me. I
Yep.
knew it wouldn't.
I'm the outlier in this that didn't work. And I always say if it's less than 2 weeks, I don't actually consider it a stall. I don't know
Yeah.
if you have a number of that, like a kind of
I
idea of
think it's a
that.
month.
A month.
A month. I think that first month, women will lose, it pretty much holds true to this, around 13 pounds. Almost all of them lose more than that. So I think that a half a pound a day
Yeah.
is
It's
unbelievable.
crazy.
Okay. On what planet do we forget that? When have you ever lost a half a pound a day? 13 to 15 pounds in a month, my ladies.
Yeah.
Men will lose 20 to 30 pounds that
Yeah.
first month. They'll lose over a half a pound to a full pound every single day.
Yeah,
It's
which is
crazy.
wild.
It's wild.
Yeah. And but what's going to happen is at week 3 you're not going to lose anything.
No, you're not. Because your body is like, what is happening?
Yeah.
It's this whole thought of the set point,
Mhm.
and that your body is constantly trying to recalibrate itself. Like, okay, are you done? Are we done here? And then it's like, oh, I guess we're not. And then like weeks go by, and then you'll lose a little bit more.
Yeah.
And then it's like this, it's a very kind of stepwise instead of a linear weight loss.
Mhm.
We have to bring this up on almost every episode because this will play with your mind in
Yeah.
really, really dangerous and dark ways. And
Yeah.
especially, again, comparison is the theft of joy. The Facebook group support is treatment, community is treatment. However, when you're comparing yourself to somebody else who had a different starting BMI, maybe you lost weight before surgery, which I think absolutely goes into the total amount of weight
Yes.
loss. And
Yep.
just there's just so many variables that it's hard to know, like percentage wise. It's you don't know where their stats are or their height, their weight, their BMI, all that
Yeah.
versus you. And it's just like stop.
Yeah, I just had that experience with somebody the other day of losing weight beforehand, and I normally I try to ask about it, but it just, I was probably running late, or you know, whatever, the conversation was quick. And it was somebody that, you know, they were 2 or 3 weeks post, and they had lost maybe 4 or 5 pounds. It wasn't maybe what I would have expected
Okay.
based on their size and things like that. And then I was like, wait a second, there's a note in here that your highest weight was like 15 pounds more or
Mm.
whatever than your surgery weight. I said, when did you lose that weight? They're like, oh, in the 2 days before surgery,
Jeez.
like on the clear liquid diet. And I was like, oh my God. Well, then you're fine. Like, I'm not worried about your
Lost
weight.
20 pounds.
Yeah,
Like,
so since surgery, but your body is like panicking, and like you're just, your calorie intake is so low. And the other thing I see a lot of times is
yes.
their carb intake is so low
Yes,
that
yes,
like you
yes.
got to actually push the carbs up a little, because the goal is not, because this is what people hear. They hear less than 50 grams of net carbs. What they think is 0 is better. And so they go lower is better. And that's really not the case. It's about finding the amount that really works for you. And I find that with most people, that's somewhere in the probably 30 to 50 range
Yeah,
is
yeah.
actually where people like see the best results. If you go too low, you're not supporting your body with what it needs. And so, I mean, it's already like, that's already a crazy low amount of carbohydrates for an adult. So like to go even lower than that. We're not looking for you to be in ketosis. We're not looking for all of this. So, yeah, that's my other thought on.
Yeah.
Now I'm ping ponging here a little, but
it's true. You have to look at your overall intake, and your body will hold on to things. I
yeah,
really think this too. The surgery is an inflammatory
yeah,
process. I mean, your body goes into survival mode. It wants to protect it.
hmm
When you're kind of seemingly in danger, your body physiologically will not be like, oh, this is a good time to shed weight. This is a good time sometimes to hold on to it.
yeah.
Until it's like, okay, you're healing,
You're
you're doing
feeding
okay,
me.
you're feeding me. Yeah.
Yeah, yeah.
You're feeding me. I know when
So,
my next meal is coming in.
mhm.
And then you're all of a sudden the weight will come off. I
Yep.
promise you,
Yep.
this will work for you.
Yep.
And you'll get through it. And I know that sometimes you find it kind of grieve life as you know it. You feel like, why do I have to go through this? This is
Mhm.
unfair. I'm sad. I'm lonely. I'm depressed. I really miss certain foods, the way they made me feel, like all that's associated with that. I think there's a lot of like head work there. I do
Yeah.
think there's a lot of cognitive behavioral strategies of understanding the feeling and understanding the behaviors you want to do. And sometimes you'll even like kind of bargain and kind of push the envelope and think, I'm going to go in here and I'm going to eat whatever I want because I don't really give a damn, you know, but
Yep.
you you do give a damn.
You do.
You do.
You went
And
through all of this. You
you
do give a damn.
exactly. So it's not worth that. Look at the bigger picture, reach out for help, reach out for support.
hmm
I think that support is so important. And obviously, we have a Facebook support group. I hope that you join it. Whether you're with our practice or not, you're welcome to be in that group. There's also, obviously, we do monthly support groups, in person meetups. You're going to meet other people through this journey who are going to give you tips. You'll post maybe on that support group, like, I'm struggling with this. And people will give their advice and
And
some
their
of those
experience.
anecdotal like experience and suggestions. I mean, we are literally kind of compiling all of this
Yeah.
that
I
I've learned from the patients.
I look at all of this and say like, oh, you know what? I saw somebody else suggest this. Because again, like I said earlier, I haven't had surgery. You haven't had surgery. We have to take the best data that we have, which is patients,
Yes.
and kind of extrapolate what we can do with that. And so you guys are truly the experts on how it feels to have surgery. Um, Coming off of this very like emotional side of things, there's two other things that I want to talk about that are normal after surgery, and it's very very basic and it's very maybe silly. Eggs and chicken, you may not tolerate them the first couple weeks after surgery. It's totally normal.
There you
Like,
have it. Spoiler alert.
spoiler alert. But some people do great with them. So again, this is one of those times where I'm like, either is normal and I'm sorry, I don't have a better answer for you.
I know. I think that they can both be, it depends on how you prepare them. Obviously, you're the
Yeah.
expert. They can be very dry.
Yes.
Eggs can give you, even if they're like scrambled eggs, I feel like it gives this like stacking phenomenon where they
Yeah.
kind of like feel like they're like, oh,
Well, and again, like some people are, and again, this is so normal, so weird, but scrambled versus like hard boiled, like
oh,
I don't know if it's the air that when you scramble an egg, it gets a lot of air in it, so it's like bubbly, it's kind of
mm,
gassy. Plus, I'm sorry, eggs have like the sulfur and like they make it gassy in general. I don't
yeah,
know. Personally, I'm gonna go here. If I'm hungover, I can't eat eggs
yeah,
because they just are like, ooh, they're just nauseating, and I
they
think they are for a
are.
lot of people in general. They can be like that.
That's a good
Not
point.
that I haven't been hungover in some time, I'll say, but like the idea of eggs. And so I totally get that. If you're just not feeling great, like don't worry about it. You don't need eggs in your diet to survive bariatric surgery. And then, like you said, chicken. I always say,
Oh
and
my
you
God.
always hate this, but dark meat is just so much better than white meat
Oh,
after surgery. But you hate the dark meat,
I
so
do. She's always like, it's so much moisture.
it is. It's got higher fat content, so it's naturally going to be
And
more
that
moist.
is good. That is
Yeah,
our friend.
fat is fine. Yeah, people ask about that one all the time. Like, how much fat? I'm like, just like don't overdo it. Don't go for keto levels of fat either. Like if you're looking at keto products, a lot of them are insanely high in fat because that's one of the tenets of keto.
Mm.
True keto is it's a very high fat diet.
Well,
But
our cosmetic surgeon that's starting, Dr. Irene Tower, she is currently on a carnivore diet, which is an extreme. It is like, oh my
God
gosh,
love her.
God love her. But she says she doesn't even eat chicken because chicken doesn't have as much nutritional content. So what she says is the best for her, since she's not getting any other food at all. She eats fatty ribeyes all day, every day. Can you imagine this?
No.
My gosh, little fun fact about
No.
Irene. You guys will meet Dr. Tower.
I wish this is one of the few times I wish we were recording this with film, so you could
see our
film
faces. We're like,
video. You can see my
eyes
face
are
right
fucking
now.
popping out. We're just like, oh, okay, that. Hey, no, it works for her.
You know,
I can't wait for you guys to meet her. To each their own on that one.
yes. Yeah.
So I got the biggest question of all
Oh.
that we didn't go there yet with. So when can I have sex after surgery, Hannah?
I always say it's up to you. If you want us to tell you a certain answer, we're happy to, though.
Yeah, seriously. Like some people
You're
are like,
give me 2 weeks here.
I know.
Sure, take it.
I know, seriously. But it is something, you know, if you want to get intimate, you want to go for it.
Go for it. Whenever you feel up to it. Be careful, obviously. I mean, maybe don't bring out the Kama Sutra yet.
Yeah.
But
we have a whole episode on sex where you can really dive deep into the getting the bad there.
And make sure you are using a form of birth control.
I know.
Please.
I know.
Please.
You're going to get really fertile. You're also going to be, your sex drive will increase.
Mm-hmm.
It's just surgery, I've realized.
Yeah.
Too. It's just like you already feel lighter and you feel more attractive and you feel like more confident and
your hormones are just all over the place.
Yeah, so you're like, okay. Oh. And then, oh man, we have a lot of stories about that. But yes, it is, it's fine. We get that question and people get embarrassed or it's like,
go for it.
Just go for it. Live it up. So, wow, I hope that your recovery, if you are listening to this and you are one of the people that it's 2 a.m., you had surgery earlier today, you stumbled across our podcast, you're listening to it. Well, first off, congratulations.
Second off, done it. Go to sleep.
Yes, go to sleep. Go to sleep after you give us a 5-star review, of course, on whatever it is that you're listening to it on. And, you know, but seriously, it's a big step in your journey. This too shall pass. You're going to feel better. It's the start of something super exciting. So look at all the amazing benefits that are to come on this wild ride that is your lifelong weight loss journey.
And as always, you can find us on Instagram at Dr. X Dietitian. I'm at hannahschuyler.rd. She's at Dr. Dovec. Send us to your friends, share us far and wide. We love hearing back from you, so DM us if you have anything. And we'll see you next time.
Bye, guys.
Bye.